to have a conversation, not just about economics, but actually focused on public health, on COVID, on what we should do about it, what's happening. And to do that, I brought in a public health expert. So I can learn a lot today, and I have learned a lot from our guest today already. I want to share her expertise with you. And so without further ado, I want to introduce Julia Raifman. So as I said, she is active on Twitter. I've had a lot of conversations with her, learned a lot about public health, learned a lot about COVID, found other public health experts through her to listen to. So today we're just going to have a conversation, and largely this is going to be Julia teaching us what she knows. So first, Julia, why don't you both introduce yourself, your background in public health, what roles you play, and then also share your journey into being someone who is very active in public spaces, sharing information about COVID and public health measures.
Hi, yeah, thank you so much for this opportunity. So I'm an assistant professor at Boston University School of Public Health. I conduct research on how health and social policies drive population health and health inequities. Prior to the COVID-19 pandemic, a lot of my research was focused on HIV and mental health and how policies like LGBT rights or firearms policies shaped mental health and suicide. And then when the COVID-19 pandemic hit, I knew it would be important for people to have information on the dates when policies changed to be able to conduct research on the policies that best controlled the pandemic and reduced economic precarity. I really saw the pandemic as a joint disaster of public health and an economic disaster. And I was really, the work on economic precarity was informed by the Washington Post article on how this is the most unequal recession in modern history, and really struck people who are low income much more so than people who are middle or high income. So in March 2020, we started out tracking the first physical distancing policies in eviction freezes, and it turned out there were many more policies to track. So we ended up tracking more than 200 variables on policies to reduce COVID-19 and to reduce food and housing insecurity during the pandemic. Our website is at statepolicies.com, and the data are publicly available for download. Our aim was really to facilitate rapid response research and policies that help. And that is still our aim.
And were these policies, 200 policies, are these ones that end up being specific to state and local? I mean, were you looking nationally, but thinking about one state has certain policies and others? And are you doing the public health policies, like the COVID mitigation strategies, or those and the economic policies, like the eviction moratoriums and that? So tell us a little more about these 200 variables.
Yeah, what's in there? Yeah, there's a little bit of everything. But I ended up doing research on both. So Kate Leifheit led our paper on lifting of eviction freezes and the spread of COVID-19 that was able to inform the CDC eviction moratorium nationwide. So we were really glad that helped. I saw other people running toward our data on physical distancing policies. And so I was thrilled that the Health Affairs study on mask policies uses our data. And I actually ran the other direction. I saw that there was not as much work happening on unemployment insurance, which I thought was a really important policy at the time. And so I looked at what happened when people received unemployment insurance, since there was so much variation, and when people were able to receive it due to the delays, and how that affected their food insufficiency, and did find that there were reductions in food insufficiency, and that those were larger during the period when there was the $600 federal care supplement. So, I thought that was an important topic. And then I was actually continuing to work mostly on policies to address economic precarity. Sorry.
It's okay. Yeah, we can.
My dog is also very passionate about these policies.
It's a team effort, right? So
yeah, the whole family joins in.
So when you look at say when you're studying food security and the unemployment benefits, do you look at how that affects different groups? I mean, I know you talked in some of your other research that you're looking at potentially marginalized groups, disparate impacts on them. Is that something you also did when you were looking at the unemployment benefits, or was it a more global, the population of the unemployed who get the benefits?
Yeah, at the time we looked at mostly low income people and their receipt of unemployment benefit, because we wanted really an accurate comparison group and knew that the people who were losing their jobs were predominantly lower income. And so at the time we looked at that, we didn't have enough subgroup data to look by race and ethnicity, but now I think we do have more data. And I think this is a really important opportunity to learn so much about policies that have been shaping economic precarity for a long time, but that we haven't had the data to study in depth. We've never had biweekly data on food and housing insecurity by race and ethnicity, and with really large sample sizes. And like absolutely, there are limitations to the data sets, like the Census Pulse survey that has a small response rate, and we definitely have to take it with a grain of salt. But I think, with so many of the econometric methods and being able to look over time, I think we can anticipate that the same bias would be there over time. So we can look at how trends change over time when policies change. And maybe that's a good point a good time to introduce that I teach quantitative methods for policy analysis, but I use econometric methods. Sydney Rosen termed me a quasi-economist. So I appreciate that phrase, and I apply quantitative methods, econometric methods in my research. So I conduct primarily difference and differences analyses, and follow the economics literature closely, though I don't develop economic methods myself. So I think I really appreciate that I am able to bring to the discussion a perspective about public, methods commonly used in public health, perspective about methods commonly used in economics, and I think what that's taught me is humility about all of it. Is that I actually, I agree that it's nice to adjust for time and time invariant characteristics. And try to use shocks to understand how changes in policies affect changes in outcomes. And I also know that those methods too are imperfect, and we see so much of that right now, right? Like so much of the discourse around the mask policy studies, show these big effect sizes, but can we really trust them? Well, I think I have enough humility to know that no study is perfect. Even randomized trials, right? Even when we have a randomized trial on estrogen and menopause, there are still questions about, well, was that the right age group to evaluate that in? We have the randomized trial on masks, and there are questions about, well, that's only one setting, and the masking was not 100%. And so, what is the effect of a mask policy where you achieve closer to 100%? And we also see that was an enormous study, a heroic effort, an achievement, and it's just not possible to do that all the time, or ethics once we have a sense that it works. So I think just knowing that that all studies have limitations, and it's important to have several studies from different perspectives is important for parsing the evidence. And I don't think there's any topic, from hand washing to medications where we would consider every study perfect, or to consider ourselves to have perfect knowledge. And that's a lot of the context in which COVID policy discourse is happening.
Right. No, and that's absolutely something that I see in economic policy advice. So even outside of a COVID crisis, that as a policy advisor, and this was something that I learned when I was at the Federal Reserve, you don't rest your advice on a single paper or a single study, especially when it appears to overturn years and years of research. Like, that's exactly when to be skeptical. And also, while we'd all like the one study that tells us the answer and solves the, like, it doesn't exist. And I think sometimes we have to be really careful not to fall into that. I want that so badly, the clarity, the know what to do, that, you know, it's not there. So underscore the point about humility. And then I also wanted to underscore, you talked about with the constructing of the data and understanding the census pulse and the small sample. So I love that you're not only doing the research and using the methods and have this sense of how to read a larger body of research, but understand the inputs. Right. And I think I've seen a lot of data sets. The census pulse is one example. These didn't exist before COVID. They were moving into a space because we needed more information and we needed it quickly. And that's hard to do and do it well. And I think often I see researchers take the data as, I was given this, and then go off and running. But as I was taught in the econometrics field class that I took at Michigan, the professor was like, you know, garbage in, garbage out, right? Like, if you don't have if the starting point isn't good, then it doesn't matter what fancy estimator you point at it. You shouldn't trust the answers.